Good afternoon, everyone, and today we'll be introducing you to Meet Me Vaccine. It's the Meals on Wheels of vaccine distribution. So first, let's meet Bob. Bob lives in rural Byron, Minnesota, and he's the sole caretaker for his large farm, and he's very technically challenged. He's considered high risk in regard to COVID-19 due to his age and previous medical issues. He's eligible for the vaccine, but he's unable to get to one of the many locations in Rochester due to the frigid weather and his unreliable vehicle. Just like Bob, millions of Americans who are eligible to receive the COVID vaccine are unable to access it. In fact, only about 3% of the U.S. population has been fully vaccinated. Ultimately, there needs to be an easier way to get people vaccinated where they are, whether it be rural schools, co-op housing organizations, Indian reservations, etc. The rate of vaccination reaching those areas and populations are lower due to the lack of access to care, inability to properly store the vaccine during prolonged transport to rural areas, and the inability for patients to take time off work. The current goal in the U.S. is to have complete immunization by the summer of 2021, but this is not feasible without some sort of consistent and organized logistical model.
Our solution is Meet Me Vaccine. We aim to provide vaccination at home or at work using mobile vans tracked by an integrated platform. This will allow patients to get safely, securely, and conveniently vaccinated, creating a standardized and consistent option to give people vaccines where they are most comfortable, while subsequently decreasing the spread of COVID-19. We plan on partnering with state and local organizations to create an integrated and accessible platform to help locate patients in need, distribute the vaccine, and maintain records compliant with HIPAA guidelines. From freezer to refrigerator to the patient's arm, Meet Me Vaccine will utilize a fleet of high-tech vehicles to mobilize vaccinations. The vehicles will contain key features such as Wi-Fi, a computer system, PPE, vaccine refrigeration, a travel nurse, a skilled driver, a lab technician, and a community liaison when needed. In communities where there are more technology and English-speaking challenges, Meet Me Vaccine will also focus on connecting with more local entities, such as faith-based organizations and community centers, to help aid providers and patients in feeling more secure in getting vaccinated. In Bob's case, his local clinic that recently partnered with Meet Me Vaccine can contact him and send him a vehicle to get him vaccinated in his own home or even work.
So how will we get those vaccines? To a tight integration with the state public health department, who are coupled with the CDC and the manufacturer, we will obtain the vaccines. So Meet Me Vaccines will get the vaccines directly from the state public health department. So how are we going to vaccinate the patients? So through our online vaccine portal, all the requests will be logged in by the clinics, workplaces, and doctors' offices. Once we get the online requests, we will process them by availability for the first shot, and similarly, based on whether it's Pfizer or Moderna, we will also schedule the second shot at the same time so that we don't have any time lag or delays. Through that information is passed on to through GPS to the van driver. We will coordinate with the requesting clinic, workplace, and doctor's offices, and the patients will arrive on the day and date, and vans will be located at the place they are arriving. The vaccination will be completed, and the CDC card will be provided to the patients. We will return for the second shot as per schedule. What is our business model? The business model is intense, like you can see right there. It's based on 3 phases. Phase 1, we plan to roll it out in Minnesota. Phase 2 in New York, and phase 3 in few other states. We want to take a phased approach so that we can learn from the Minnesota experience, as well as demonstrate to the venture capital funding agency and everybody who's vested in us, as well as the state health department, that this is a proven venture with long-time success and longevity, not just for this pandemic, but in future for any other pandemic or endemic, as well as other adult and pediatric vaccines. The business case is strong in many instances. One being healthcare quality reduction is dependent on having quality interventions like vaccines in pediatric stage as well as adults in a timely manner. We all know the at-home care is increasing. This definitely in that alignment, and also the revenue model is we are developing that as we speak to have that as patient transaction, which will be paid by the state.
To bring it home, Meet Me Vaccine integrates
Time.
vaccine.
Excuse me. That's time, folks. Thank you very much.
All right, so we are working for Salisense Medical. So my name is David Soriano. I am a medical student at Mayo, and my partner and lead engineer on this project is Michael. He is a clinical innovation fellow at Northwestern. So we are working on developing a device for assessing the fit problem with prosthesis for lower limb amputees. Here we have a testimonial from our PM&R consultant who is telling us about the issue that he's facing in the clinic.
Hi, everybody. My name is Dr. Noel. I'm a physician in rehab, and I work with patients who have lower limb amputations and prescribing prosthetics. And so in my clinic, we have a lot of challenges with poor prosthetic fits. We know that patients can feel very, very small changes in the sizes of their residual limb. And often these poor fit complications include skin breakdown, potentially wound infections, and then in the worst case, admission to hospital or surgical procedures to fix them. And so trying to get a good fit is a challenge, especially because it's an ongoing process and there's kind of not really objective ways right now to measure that.
All right, so as we can see, this is a large issue both for cost and for the patient. It can cost over $13,000 to get a prosthesis fit right because of all the iterations that have to be done. Also, we did some statistical research and found that over 55% of amputees will eventually develop a pressure ulcer. And at a cost of $9,000 to treat these ulcers on average, for the number of patients that we have per year, this is over a $600 million healthcare cost to treat these issues. There's also the human cost of pain and suffering, and also these patients are usually very susceptible to infections and can actually die from development of an infected pressure ulcer. There's currently some options on the market that are trying to solve this issue, but mostly they're just focusing on universal fit as well as adjustability, but they really don't get that customized fit or the ability to really detect pressure spots that could be problematic. So in order to develop our design process, we set up a list of constraints and objectives. Just to name a few, this obviously needs to be affordable, it needs to be comfortable, it needs to be long lasting enough to be viable, and it has to really accurately sense where these pressure spots are in a way that's measurable and can be have action taken on it. So we developed several options. There's obviously the short-term fit test option, which is really just used as a tool by the clinic to assess the fit of the device, and then it's returned. There's a take-home disposable, which would transmit data to the clinician about the fit. And there's also the long-term wearable option, which is meant to be a daily use item that would not only identify changes in fitment, but also alert the patient if it detects a pressure spot that is concerning for the development of an ulcer. So here's the prototyping process. We were able to make an initial prototype with 3 sensors that was able to accurately detect pressure based on heat and friction and relay that information to the computer. And here's the final design prototype model. We have a linear array of flexible capacitive pressure sensors. There would be temperature sensors incorporated, which could be used as an early warning sign for infection. This would be a drop-in replacement for the silicon sleeves that are currently in use and would be mainly made out of silicon itself. And it would allow for continuous monitoring of pressure and any pressure changes, as well as an alert if it detects pressure that could potentially cause an ulcer, which is really preventing this issue before it happens and the cost that we mentioned earlier. Retail would probably be about $100 at launch on initial cost assessment, so that this would probably be about an 80% profit margin at that cost. It would also likely be a class 1 device and would thus be 510K exempt and easier to bring to market. It would be initially paid out of pocket by the patient, but then hopefully an outcome-based reimbursement plan would allow us to have insurance coverage for the device. And just in a summary, poor prosthesis fit is a debilitating and expensive issue in healthcare. This concept would provide a home healthcare solution that would allow a data-driven approach to solve this issue, and it would solve an issue for both patients and for the medical system as a whole. Thank you. I would welcome any questions.
All right, so I think we can get started then. Are you going to give us a time warning at the end, or should we just?
I'll give you 30 seconds in the chat. Would you prefer me to say it verbally?
Yes, because I can't see anything except the screen right now.
All right,
so.
I'll see you in 4 minutes and 30 seconds.
All right. Hi, everyone. So I'm here to present Careplan. So Careplan is a one-stop health schedule triage system for primary oncologist patients and their referred healthcare providers. So what's the problem here? So currently, medical oncologists are more focused on the underlying pathology and treating the cancer, and that ends up causing referrals to be lost in the system. So cancer patients are undergoing immunotherapy and they're very immunocompromised. And what if, you're in an area where access to healthcare is limited? And to add to that, let's say you're a care provider and you have the burden of taking care of your, let's say, father or grandparent. So how can you deal with all that? So and in the realm of advanced home care, I can tell you that the CMS has just released a waiver for 24 hours for nurses to actually facilitate those and take care of the patients. But the problem is that these nurses are actually scheduling those appointments and those queues based on the importance of the reason for the patient's visit. So they're occupied with that instead of taking care of the patient. So even if the CMS has put out that law, how can we ensure that nurses provide that meaningful care that patients need? So here I'll just show you a snippet of what's currently happening with the survivorship care plan. The thing is, most of the patients are not getting one, especially breast cancer patients that we're focusing on. And here you can see just a form of the template that's used to fill the survivorship care plan once a patient visits a provider. And with our plan, we hope to measure some outcomes such as depression or fatigue, just from the care provider and from the physician and the patient to create a holistic plan. So here, I'll just show you a quick rundown of the workflow we have. So let's say a patient visits a oncologist and then they schedule, the oncologist tells them, okay, you need to go see a radiologist in a set time. So then the oncologist will tell them, okay, you need to see a radiologist, and then there's a shared calendar where they can actually, both the physician and the patient can see that calendar and know where the next appointment is. So we hope to integrate with Epic to actually retrieve that calendar data, and we actually have a demo to show that FIRE retrieval of the calendar data and how we can auto-populate the calendar to remove that nurse from that system for her to focus more on the on the patient and to help facilitate that. So we also have patients here, they can specify their availability and location. So this is the interface that we have here, and this is the shared calendar that gets auto-populated, and this is just an interface we'll demo here. So here's just a quick representation of the hospital calendar sharing network. So let's say a patient wants to book an appointment at Hospital 0, and our network 3 and 4, which are other hospitals, get a copy of that calendar, and it's always happening like that. So it's kind of a resilient system. So I'll just demo here one aspect where, let's say a server is shut down, and based on the majority vote, we can see that, here, let's see if we can play that. Oh, right, okay, so there's a problem with this demo. Okay, all right, maybe that one. See if we can play that one. Okay, all right, so the demo won't work right now. I'm not sure why, because of the video, but I think you have access to the video so you can see the demo. But what we were trying to show was basically that if one server is shut down, based on the majority vote, the calendar appointment will be booked. But basically, if one calendar was shut down, or one hospital is shut down, we actually can book the appointment because Hospital 3 and 4 gave us that thumbs up because they have access to that calendar. But if 2 hospitals are shut down or don't have that information, then the calendar appointment is not booked. And that was actually shown here in the demo. But somehow we won't be able to show you right now. And one last thing here, we integrate FIRE into the application. So here you can see we use the Open Epic to create that integration with Epic. And this is just how we access the FIRE resources for the available
30
slots.
seconds, Dan.
All right, and here's just the available time slot that we booked. In this case, it was May 2021. And this is our business model. So we hope to integrate with healthcare systems and start with Epic as our large market share, and integrate with Epic app Orchid. And then we hope to target outpatient provider clinics with our own app and integrations. So this is the landscape, and where we stand is our automated calendar sharing system, one-stop shop. So
thank you very much, Dana. Good job.
Right. Thank you.
Good job.
Okay, and before doing that, I really want to thank you and rest of the organizers for allowing us this opportunity. Thank you, the mentors, for phenomenal input, and the judges for your time and consideration. I'm starting right now. On behalf of a diverse team of 5, we would like to present our brand here, My Safety Check, where our vision is building a safe experience for care delivery team in a remote patient care environment. So yesterday, we started with a hypothesis where we felt, are we putting our care delivery team safety at risk when we are deploying them in the remote care environment without truly any standardized safety measures and all? And I would like to invite my friend Adam, who is a paramedic with Mayo Clinic, experienced these challenges real time, to talk about the problem statement, and then we will get into the solutions. Adam?
Yeah, thank you, Sai. And I would say yes, yes, we are. As a paramedic, I was trained to go into a scene without a lot of information about the scene or the patient I'm caring for, and have almost a decade of experience doing so. But what about the rest of the mobile integrated healthcare providers, including nurses, mid-level providers, CNAs, PCAs, and technicians? In some form or another, they've all articulated to me that, they don't always feel safe or comfortable when dealing with the different types of adversity, including uncooperative patients, gas leaks, large animal present in the patient home, or even navigating adverse driving conditions and inclement weather. All these are risk factors that could and should be addressed. Thanks, Sai.
Thank you, Adam, for sharing your experience. Well, we stated a little bit of problem statement as well, and really got into the crux of it, which is limited awareness about that remote patient environment that we are talking about, and how to ensure the assessment of physical and the environmental safety risk prior to deploying our delivery team. We literally have limited to no control to employ a security measure at those remote care delivery sites to reduce the unsafety situation or health hazard situation that's there. Or there isn't really a true easy way existing today that we are aware of, that a real-time feedback loop will be there with the command center team and the team at the site delivering the care to the patient. And as a whole, I think the lack of policy, standardized matrix, and governance structure around this new working culture from remote location is not there to guide us through that. So we hope through our solution to solve these problems. Moving ahead and looking at the solution that we iterated through and bootstrap and thought that it would be good to solve those problems are based on an IoT, a mobile app, and a web-based intelligent platform, which will deliver a minimal intrusive safety check, as well as allow those team who are there an automated decision support system, with patient's privacy being the paramount core of it. So the integrated system will provide an unified and real-time view to the on-site care team, as well as it's a data aggregation and collection engine which allows a decision support for the team which is there right in front of the patient setup. There will be an app which will be delivered and being accessed through PDA or handheld device by the care team who is at the on-site, which will allow them a map view, which is kind of a bird's eye, looking at the weather, looking at the site information, traffic information that will allow them to understand the environmental safety aspects of it. And when they're in front of the patient's environment, or maybe before, look at a 3D layout view of the patient's residence to understand and map out what environment that they're walking in and how they can handle it. Last but not the least, there will be an employee wearable, which will do a pulse check or a real-time vital monitoring of those employees who will be in the setup. And then there will be a minimal intrusive safety check alert to ensure the safety of the employee, and based on the feedback, take some actions. GPS tracking will allow us to get them physically located and where they're at. And in case of a backup support required, it could be more real-time and more precise. Considering these solutions, we feel that we do offer a key business and market value, which is focused around safety of employees and those employees in a remote setup, which not necessarily is when we are in a healthcare setup where we are inviting patients in our mode rather than we are now employing and deploying employees in a more remote setup. With that said, we did a little bit of market validation, and I'm going to invite my friend Masha to talk about the validation that we did.
Thank you, Sai. Based on our brief market assessment, we found that there are more than 1.5 million employees in the home care setting and a market size of more than 100 billion in 2018 only, with a proven growth trend. Based on our competitor analysis, we believe that there is a huge market opportunity for this innovation technology since all current solutions are focused and tailored on the patient side, whereas our remote safety care technology would provide measurement of safety to the caregiver. On the monetary side, the subsidies can be provided by the government to cover the development costs. And from economical aspect, it can potentially lead to insurance premium reduction due to risk awareness to the caregivers.
Thank you, Masha.
Thank you very much.
Is that time?
That's time. Thank you.
Okay.
All right, I'm going to start now. Hi, we're Team Iring, and here's our team members. And the problem we're trying to solve today is that according to our research, the market today provides few medical alert devices that are both easy to operate and affordable to elderly patients with lower income, causing limited accessibility of essential life-saving technology.
So our situation we have here is Mr. X. He's a senior with constant heart arrhythmias that needs continuous 24/7 monitoring. One day on the 5th floor of his apartment, he suddenly has a heart attack. Now, the hospital would get alerted late. They would not have all of his vitals. They wouldn't know what floor he's on. So if we had iRing, then they would be informed of all of his vitals, his X, Y, and Z coordinates at the time of the heart attack, and they would be there a lot sooner.
Yeah, and for our design specifications for hardware, we want it to be single-handedly usable, and it can actively and passively send alarm signal. And also, one charge should be able to provide 1 week of usage. And for software, it's supposed to be able to find the nearest hospital or EMS, and it can send out precise XYZ coordinates. As for the hardware design, as you can see here is our prototype, and on the right is the dimension of it. So it has a rotary knob, which is also a button for sensor level, indicating the stress level of the patient. And also the ring itself is adjustable in size, and there are sensors inside for detecting heart rate and oxygen saturation. And also the design of the ring is for maximizing battery volume.
So this is a quick glance at our web application. This is designed for the healthcare workers, for the providers. It goes hand in hand with our mobile app, which this is a quick glance at, which is for the patients. It has all of your records, emergency contact, everything they need to know. Now, there is an active and passive part of the iRing. The passive part would be it monitors your symptoms. So if it looks like something's concerning, like you're having a heart attack, it automatically sends a message to the ER with all of your records. The active portion would be you yourself activate the ring by turning the knob or pressing the button, and you can send your information over to the nearest hospital as well.
As for the false alarm prevention, there are 2 ways to do that. For the hardware, the user has to twist the knob in order to allow the pressing of the button. And also for the software, it will show a message saying that it's going to call for ambulance and you can cancel it. So those are 2 ways to prevent accidentally triggered emergency sign.
These are our competing designs that are already on the market. Smart Health Watch and the chest strap heart rate monitor, which you've seen. The difference is ours is single-handed use, and it's in cooperation with medical institutions, and we are targeting people with cardiac diseases and mainly elderly people, and it's extremely affordable.
And for other value of the device, timely concern is that this device can provide insurance information, accurate location, and real-time ECG of the patient to nearby emergency room as smart matching. So also that there is a past medical record and emergency contacts on our web application. So the experience of the user and the healthcare worker will be greatly improved. And for the production plan, we plan to 3D print the device for now to check compatibility of the prototype. And we will also check functionality between the electronics and iRing app. And also, we will do the programmable milling machine of the prototype with a higher precision. And finally, we will do injection molding for the final production. And our current limitations include that we will try to even further improve the battery life, and we'll find a better balance between size and comfort. And we will try to lower the cost even further for the market and user. And also, we will try to provide more language options to increase the diversity of app interface.
For our future directions, we're wanting more functionality, hopefully to measure more vital signs that are important. We would like sustainable materials to help the economy, and other sensors like it can detect if you're falling, and in the ring to cover other diseases and expand our customer group as a whole. This is our amazing team and all of our jobs, and that was our vision of iRing. We will take any questions.
Thank you very much.
Thank you.
Good job, iRing team.
So good afternoon, everyone. First, to thank Mayo Clinic for providing us this great opportunity to participate in the Innovation Sprint. We also would like to thank all the mentors for your tremendous support and help during the contest period. Today, we would like to introduce a human-centered real-time stroke monitoring system. First, I'd like to share with everyone a real sad story. Dr. Tian's neighbor is about 80 years old and lives alone by herself. Her husband passed away a few years ago. She enjoys living by herself independently. She likes her comfortable home environment like everyone does. She does not want to go to a nursing home. Until one day, she fell down because of a stroke or heart attack. She could not get up by herself. She stayed on the ground and for at least 24 hours. Fortunately, she was found by another friend when they come by to visit her. She was still alive. Then she had no choice but to sell her house to live in a nursing home, although she preferred to live by herself. We could not imagine how hopeless she was when she lay down there and could not do anything during that 24 hours. However, it was too late. Each year, approximately 795,000 people suffer a stroke. Someone in the United States has a stroke every 40 seconds. More than 420,000 individuals die as a result of falling. So our team came up with this idea of designing a real-time monitoring system for elderly people living at home alone. We use Google cameras or infrared cameras with AI speakers to monitor our elderly people's home. Let's use Dr. Tian's neighbor as an example. If she accidentally falls down because of a stroke or heart attack, with the older video amplification technology, our real-time monitoring system would detect that and ask her if she's okay. If she needs to call someone or the family doctor, then our AI speaker would do that for her. If there is no response after a few attempts, our AI will call her emergency contacts and send that alert messages to her family doctor or contact the 911. With this new platform, Dr. Tian's neighbor would be able to get immediate help and would not stay on the ground for 24 hours. Our system would also come with a monitor screen. Family members can check their health status from their phone. Grandchildren can say goodnight to grandparents before they go to bed. The personal care assistant would not have to drive to her home so frequently. Nurses or doctors could check with her remotely about her health status. And another part of our system is we would like to provide a headband or a hat or a comfortable pad every day to monitor senior people's brain waves when they sleep. The data can be transmitted to Apple Watch or iPhone Health app. Doctors can view this data online as well. It is also helpful for family members or doctors to track the sleep state of the elderly as well. And last, I would like to show our business model canvas. Our partners are Medicare, Mayo Clinic, Google, and other research institutes. I believe that our system can effectively improve the health of the elderly and reduce the mortality of sudden disease like stroke, and enhance happiness and reduce medical expenses for those elderly who have the desire to live alone. The customers of our system are elderly people, especially suffering from heart disease, high blood pressure, stroke, etc. As well as Mayo Clinic and other hospitals, there are insurance companies. I believe that in the future, our system will have more functions and we will face a wide range of customers. Thanks for listening.